That's oh my. Kind of intrigued by what we're broadcasting here. Good morning. Good morning, ladies and gentlemen of the House Judiciary Committee. It is the 28th of January, 2025, and it's 11 o'clock. We're going to have our fiscal briefing now with David Romans from DLS, who's going to tell us all about the budget and answer literally all the questions that you have. Or some of the questions that you have. That would be probably better. So, okay. We have a PowerPoint, and we will go from there. Mr. Romans, please.
Really quickly, happy to answer questions if the committee has time. So as you can see on the screen on page 1 of the document, all right, page 1 of the document, the top of the page shows you the overall growth in the budget in the chart at the top. It's a $67 billion budget, grows about $791 million over the prior year, or 1.2%. State general funds actually decline to just over $27 billion, a $274 million decrease, or 1% decrease, largely due to the governor doing quite a bit of cost containment in this budget, as you will hear. Some key points about the budget. On a cash basis, it is balanced for fiscal 26, leaving $106 million balance in the general fund. The governor leaves a little over $2 billion in the state's rainy day fund, which is about 8% of general fund revenues. Spending Affordability Committee had set a goal of 7.5%, so he surpassed that goal. The Spending Affordability Committee also set a goal of achieving structural balance for fiscal 26, which means that your ongoing revenues will cover all of your ongoing costs. The governor's budget fails to do this. It comes up about $186 million short. The General Assembly has always abided by, with one exception, has always abided by its spending goal over the last 40 plus years. So to do so will require additional revenues or additional budget cuts or a combination of the two to make up that $186 million gap. A significant portion of the governor's proposal is contained in the Budget Reconciliation and Financing Act, which is, I believe, HB 352. If you turn to page 2, or look at page 2 on the screen, you can see that act contains about almost $3 billion of actions, revenues, transfers, and cuts. These are not all of the budget balancing actions. These are the ones that require a change in statute in order to effectuate the changes. So the biggest grouping, the top, is the revenue adjustments, about $1.3 billion of general fund revenues achieved through the governor's plan. About $691 million is from personal income tax reform. I will talk about that more in a couple of minutes. 2 lines down, another big piece is that the governor is proposing a capital gains surcharge on the personal income tax to generate $128 million. A couple of other things under revenues. He's proposing to increase the sports wagering tax from 15% to 30% on the companies operating the sports wagering. And on table games, the tax goes up from 20% to 25%. And those would both start actually in the current fiscal year, so before the end of June. Transfers to the general fund are another component of the plan, about $634 million, $230 million, the biggest item, coming from the local income tax reserve fund. This has been something the state has rated in the past when we have difficult budget times. There is a repayment plan in the governor's proposal that starts in fiscal 29 that would fully repay the money that we're borrowing. The spending reductions are the other big area, about $1 billion of spending reductions in the Budget Reconciliation and Financing Act. The largest item is just putting less money in the rainy day fund, a $420 million cut. Again, that still leaves us with more than $2 billion in the rainy day fund. Next biggest cut item relates to Medicaid. The state has had for many years now a hospital assessment, which is sort of an extra surcharge, if you will, on hospital bills. And the governor is proposing to increase that on an annual basis by about $100 million. The money goes into a special fund that supports Medicaid, so it reduces the need for general funds to support Medicaid costs. it would bring the total assessment on hospitals to about $394 million. Most of that, I should say, is paid by the payers. A very small portion is sort of eaten by the hospitals, but most of it is just passed on to payers. Something you probably have heard about is the governor's proposing a change in the way we fund teachers' retirement for K through 12 schools. Under current law, the state pays the normal cost, or the locals pay the normal cost. So that's your pension contribution for all the teachers who are working that year. The state makes, or I mean, the local governments make the payment for those teachers to kind of cover the future costs of retirement for the year of service they're going to have. The state picks up any unfunded liability related to the teachers' retirement system. So you get an unfunded liability, for example, when our investment returns don't hit the goal for the year. So the state is on the hook for making up that difference. This year, that number grows by about $180 million, and the governor is electing to have the locals cover half of that growth. So they'll pick up a little more than $90 million. So they will pay the normal cost plus $90 million. And that is a permanent change. So every future year, they pay the normal cost plus the $90 million. So that is a cost shift to local governments, not to the school systems, but to the counties in Baltimore City. I think the only other one I'm going to mention here is there's a no retirement reinvestment, about 5 lines down, $43.6 million. The state did pension reform, I think it was in 2011. And we've been reinvesting some of the savings from pension reform into the system to improve the funded status of our pension system. The governor is proposing to stop making that reinvestment payment. So we'd still pay what the actuaries require we put in, but not put an extra payment in to accelerate our return to a healthy funded status. And you can see there are a number of other cuts listed there. I'm not going to go through all of them in detail. I do want to turn to page 3, though, and look at the big picture for a minute. So this graphic shows you the structural budget outlook. Again, ongoing revenues versus ongoing spending. The blue dotted line was what Legislative Services was forecasting when we briefed the Spending Affordability Committee in December. The orange bars are what the governor's budget is proposing as a structural deficit. And you can see for fiscal 26, he largely eliminates it, just has 186 million structural gap. And in all the other years, there's substantial progress versus the December forecast, a much smaller structural gap, but still very significant structural challenges starting in fiscal 28 through 30. So this is like phase 1 of your budget solution. There'll have to be a second phase solution eventually to deal with that 28 to 30 time period and beyond. Page 4, the graphic there is just showing you back in December, Legislative Services forecasted a $400 million deficit in the current year, a $3 billion deficit on a cash basis for fiscal 26. And we're showing you how did the governor resolve that $3.4 billion combined deficit. It's about 40% cuts, 40% revenues, 20% transfers. Now, page 5 takes a little deeper look at the cuts. So where is the spending? Where is the spending lower than what we were assuming back in December? The Budget Reconciliation Act that I hit you a couple of the highlights is the $1 billion of what's lower. There are 3 policy areas that get significantly less funding than we were anticipating. The first is the Child Care Scholarship Program, which provides child care subsidies for lower and moderate income families. There's about almost 42,000 people in the program right now. The governor is proposing to cap the program at that level. We were projecting that enrollment would grow to over 50,000 people in fiscal 26. It's been rapidly growing over the last couple of years. So it caps the number of children who will be served, producing quite a bit of savings. Public higher education, the university system in Maryland will get about $106 million less in fiscal 26 than they received in fiscal 25. So that's about a 5-6% cut from the university system. They'll have to either make cuts or backfill with tuition and fee revenues, or some combination of the two. The third area of significant reductions and lower funding than we expected is developmental disabilities. The state discovered back in the fall that we had significantly underfunded the Developmental Disabilities Administration in the current fiscal year. And when I say significantly underfunded, I mean like $450 million on a $1 billion program. So the governor has provided a deficiency for the current year and put adequate funding in for fiscal 26. But as part of his plan, he's proposing cost containment measures, about $97 million in the current year and about $235 million in fiscal 26. I think there'll be a lot of discussion about these measures. Most of them he was able to just do himself in the budget, so they don't require any sort of legislative action, but I'm sure the budget committees will take a close look at what's been done there. If you turn to page 6, there were some areas where the governor put more money than we expected in the budget, and the ones that were sort of discretionary are highlighted in that chart on page 6. I'm not going to go through these in a lot of detail. What I would say is about 2/3 of them are related to the governor's economic stimulus proposals. A key component of his budget is about $128 million total to try to stimulate particularly the private sector in Maryland to grow our economies. We've been growing at a very sluggish rate the last few years. All right, I'm going to change gears on page 7 and turn to the taxes and revenue parts of the governor's proposal. So page 7 focuses on the personal income tax proposals. The tax brackets are shown there in the middle of page 7, the current rates and then the proposed rates. We've highlighted in yellow those rates that are changing. So the changes are both at the bottom and the top of the brackets. At the bottom of the brackets, the governor's consolidating the 4 lowest brackets into one bracket with a 4.70% tax rate. So for your first $1,000 of taxable income, you'll now pay the 4.7% instead of 2%. For the next $1,000 of your income, you'll pay the 4.7 instead of the 3%, and so forth. But when you get to, for the individual filer on the left, for people with income between $3,000 and $100,000, there's actually a slight reduction in your tax rate from 4.75% to 4.70%. This is one of the reasons the governor is saying that a number of households will see a tax cut as a result of his proposal, is this small reduction in the rate for a significant amount of income. The other changes are in the top of the bracket. Governor's proposing 2 new tax brackets, one for the single filers, which starts at $500,000. It starts at $600,000 for joint filers. It creates a 6.25% bracket rather than the current 5.75 at that income. And then for individuals with income over $1 million, it goes to 6.5%. That kicks in at $1.2 million for joint filers. And those are permanent changes that the governor's proposing. Then, as I mentioned earlier, there's also a capital gains surcharge on anyone who has income of $350,000 or more, taxable income of $350,000 or more. They would pay an extra 1% on their capital gains income. That part of the proposal is for 4 years only, and the governor is saying is what funds his economic stimulus proposals. There's some bullets there on the bottom of the page that are also significant in terms of what the changes are. Perhaps the most notable is the governor is proposing to eliminate the ability for Maryland filers to itemize on their Maryland taxes. This will mainly affect higher income households who itemize, have a lot of things they can itemize. They will have to take the standard deduction on their Maryland taxes in the future. The governor is also doubling the standard deduction to $5,600 for an individual and $11,200 for joint filers, and that will be indexed to inflation going forward, so that will grow over time. So for people of more modest means who already were using the standard deduction, this will increase their standard deduction and reduce their taxable income some. So that also contributes to a lot of families seeing a slight tax cut in the governor's plan. Last thing I'll mention is there's also a child tax credit in state law. You have to have income of $15,000 or less to qualify for it. If you qualify each child under the age of 6, you get a $500 credit for that child. If you have disabled children over the age of 5, you also get the $500 credit. The governor's concern with this tax credit is that right now it ends at $15,000. If your income goes up $1 more than $15,000, you lose the entire credit. So he's proposing to phase it out with income up to about $25,000. All right, now turning to page 8, this is a detailed listing of the revenues associated with each individual part of the governor's tax and fee proposals there on the top part of the page. They add up to $1.4 billion in revenue in fiscal 26 and fairly similar levels in subsequent years. We've color-coded it, so the dollars that show up in black go to the general fund. The dollars that show up in blue go to the Blueprint Fund, support K-12 education. The green represents money going to the Transportation Trust Fund, and the red is various special funds that support the programs in Department of Environment, Department of Agriculture, and so forth. I've talked a lot about the income tax changes. There are a couple of other notable tax changes about 6 lines down. We talk about the corporate income tax. So the governor is proposing 2 changes. One is to move to combined reporting, which has been discussed for many years by the General Assembly, but never done. The other is to reduce the corporate income tax rate from 8.25% to 7.99%. That would happen over 2 years, or phase it down over 2 years. So the net of those 2 proposals is supposed to be more revenue for the state. The other area that he's making some kind of changes to the tax system is the next 2 lines, or the next 2 lines down. It's to death taxes. The governor is proposing eliminating the inheritance tax and then offsetting the revenue loss from eliminating that tax by lowering the estate tax exemption from $5 million to $2 million. So combined, it's supposed to be a net neutral proposal, but it does have different impacts on different people. In transportation, the big new revenue is a retail delivery fee of 75 cents per order. So this is if you order from Amazon as an example. You can order as many things as you want in the order, and they can send you 6 packages or 1 package, however they want to deliver it. You're going to pay 75 cents for that order. It doesn't matter how many actual boxes come to you. The 75 cents only applies to things that you order that are subject to the sales tax. So if you were to get a grocery delivery that's all just food, that's not taxable, you would not pay the 75 cents. But if you get one thing from the grocery store that is taxable, you would pay the 75 cents. Other major change in transportation that generates about $140 million a year is to limit the trade-in allowance to vehicle purchases of $15,000 or less. Right now, every vehicle purchase, if you have a trade-in, you get the trade-in allowance. This would limit it to just those of $15,000 or less. So it's going to apply only to used cars and obviously only to some used car purchases. So those are the major revenue items. Turning to page 9, just going to hit a couple of key points, other points about the budget. K-12 education. There's a $551 million increase in K-12 education funding, about 6%. But there are also cost containment measures proposed for the Blueprint Fund. Couple of key ones to mention. There's a behavioral health element of the Blueprint Fund that is supposed to provide $130 million a year for behavioral health services for school-age children. The governor is proposing cutting that to $40 million, and that's a permanent change. Second change that he's proposing is that the foundation part of the K-12 formula is supposed to grow starting in fiscal 26 to phase in more collaborative time for teachers, which means a little bit less time in the classroom, more time for training and working with their colleagues and so forth. The governor is proposing to suspend that phase in for 4 years, starting in 2030 instead of fiscal 26. That saves about $124 million in fiscal 26 and over $500 million by fiscal 29. Part of the rationale that's been put forth on this is that we don't have enough teachers to make this proposal work, that we need the teachers in the classroom. We don't have enough additional teachers to be able to hire right now. Another key component of his changes is there's something called the concentration of poverty grants. These are grants that go to schools with a high percentage of their students in poverty, and they go directly to those schools. The governor is fully funding that program in fiscal 26, but he's suspending the growth in that program in fiscal 27 and 28. So a 2-year pause on the growth in the program. That saves about $70 million in fiscal 27, almost $200 million in fiscal 28. There are some new Blueprint-funded programs, many of them targeting trying to attract more teachers to Maryland. And and there's also some additional money for kind of additional help for students who need help with reading and mathematics. All of these except for the consortium, the behavioral health part, are in a separate bill that will be focused on the blueprint. The behavioral health part is in the BRFA. Last thing I'll say on this page is healthcare providers in the state will generally get a 1% provider rate increase this year. Turning to page 10, I'm just going to hit a couple of the bullets here. The third bullet down, state employees actually get a raise in this budget, a 1% COLA, and they also get their usual merit increases or increments, if you will. That costs $180 million of general funds. In terms of local aid, there's $144 million of costs being shifted to local governments. So costs that the locals will have to pay that the state previously paid. Page 11 just kind of highlights key fiscal topics for discussion during the session. Obviously, the long-term sustainability of the budget is a major issue. Another major issue is that this budget makes no assumptions about significant cuts at the federal level. There's obviously two risks. There's the risk of the federal workforce being significantly cut back, which many of those people live and work in Maryland. So that would hit our economy and our income tax revenues. The other risk is that the federal government cuts grants that go to states and local governments. You may have seen in the media today, they suspended all grants going out to state and local governments while they take a look at those programs. So there's risks to both just getting less federal funds in our budget and also to seeing our economy harmed. And that's not built into the budget forecast because obviously no one knows quite what those impacts will be. And the last thing I want to talk about on this page is back in 2023, the General Assembly passed the Child Victims Act, which allows people who were the victims of sexual abuse while in state custody to make claims against the state. There's no statute of limitations. Roughly 3,500 people have come forward so far, almost all of them who were in juvenile services facilities going back as far as the 1960s. The tort liability is capped at $890,000 per occurrence. Occurrence is not defined in the statute, so it's a little difficult to estimate what the maximum liability for the state would be. The Attorney General's office has hired outside counsel with expertise in these types of cases to help advise them, and they are negotiating with plaintiffs' counsel. There is some hope that they would have a settlement agreement before the end of session. There is no money in the budget for any such settlement agreement, nor is any money specifically reserved outside of the budget for a settlement agreement. So if a settlement is reached and there's a first-year payment in either fiscal 25 or 26 that the state needs to make, the governor and General Assembly are going to need to find the money to make that payment. But again, we don't know whether there will be a settlement before the end of session, and we don't know how much it would be if there were one that requires an initial payment. Mr. Chairman, those are like the kind of quick look at the budget. I'm happy to answer questions if the committee has time.
Okay, so here's how this works. If you are unhappy with something that Mr. Romans has laid out in the budget, that's one thing, but that's not his job. His job is here to tell you what is in the budget, not necessarily to defend it or not one way or the other. So please be nice to Mr. Romans. With that, Delegate Moon to begin, and then I'll make my way around.
Thank you, Mr. Chair. Thank you for the presentation. It's very clear, and I think a lot of good context was in there for some of the trade-offs. I have a couple questions, if you'll indulge me, Mr. Chair. First, I'm just curious if you can tell us, had we made these changes a year ago, what's the cost to the out-year deficit of every year we delayed doing this?
I don't have a precise number. I mean, we would have, if we had done all these changes a year ago, we would have built up a larger fund balance, both in the blueprint fund and in the general fund. That would make it easier to, pay for probably another year of the costs. That structural gap would probably be pushed out a year if we'd done this a year earlier. So instead of the gap becoming a real problem in fiscal 28, we'd probably push it out to 29, and it would be smaller because you'd have some of the ongoing income tax revenues and so forth.
But something like the spending, but what is the spend, I guess, what does it net to in an annual year all of these the blueprint changes, the revenue changes, and the spending cuts, they must net to some number that would have been saved, I guess, right?
Yeah, it would reduce spending by about $1 billion a year, and then that creates the revenues of over $1 billion a year as well. So a couple $1 billion
That seems
impact.
like a substantial change by doing these things sooner. So I just throw that out there. I was intrigued by the part, I guess the other thing I'm just a little skeptical of is when we've programmed things into the budget that come back to haunt us later. And I flag a couple places where you mentioned something, pause spending, you said at one point, okay, well, or who's coming back to promise we're activating or deactivating that spending in 2 years. So I just flag for the public that one item I heard. The other one you mentioned is, I'd like a little more info on this. You said that on the local revenue, what was the term you used? The local income tax reserve fund, we have borrowed from it, but I guess there's some expectation that we're putting the money back. Could you just tell us what the amount of that, like what's the philosophy behind this? You said 7.5% was the target for the overall reserve, and this is a subset of that?
So the local income tax reserve account is an obscure fund that the state collects the income tax both for the state, but also for the counties and the city. And so we collect all the money and we put the money that we believe is the local share of what we collected into the local income tax reserve fund. And then 5 times a year, we make distributions to local governments to give them their share of the money. And we've been doing this for many, many years. For accounting reasons that I'm not going to try to explain in great detail, the accountants believe we need to have an amount of money that creates a fund balance in that account that carries over from year to year. And that balance is quite large, and by large, I mean more than $1 billion. And it's from an actuarial accounting standards, you need to have that money there, but on a cash flow basis, you do not need that money. So the state has, in times of fiscal distress, borrowed from that fund to kind of cover short-term budget challenges, usually with a repayment plan. For the most part, we have repaid it, but we have not always repaid it. So the actuaries would say we do not have as much money as we should in the account. I
see. Okay, well, that sounds like what I thought it sounded like. So, sorry, and hopefully that those aspects of this budget plan are minimal. Is that fair to say? Those kinds of games. Yes,
I would say very minimal.
Okay, and sorry, the last question is just a general question. The last thing you mentioned was about the sex abuse liability for the state. So that's on the minus side. I'm just curious on the plus side, the AG is running around suing a whole bunch of others and joining multi-state actions and collecting money from the state. Where are those funds as they come in, programmed or not programmed into the budget? Is that windfall money when it happens?
Yeah, so it depends on the settlement. It often the money goes to the general fund. Years ago, there's a cigarette restitution fund in state statute. Money all goes into that fund and then is used to support healthcare costs and some other expenses. So, I mean,
is there some amount that's projected, or I guess, have we already accounted? I'm just wondering if we can offset the sex abuse liability with other incoming settlements that we're getting on the positive side of ledger, or is that money already spoken for other than things that we have to use for whatever mitigation? Is that money spoken for?
Settlements that we know about are all budgeted. So there's always the possibility there'll be some other settlement that comes along during the year that will help us. But, everything that we're aware of that there's an actual settlement on that the state's getting money has been accounted for in the budget.
But cases in the pipeline or active cases that haven't gone to settlement are not budgeted for in any way?
Correct.
Okay, thank you.
Delegate Kaufman.
Thank you, Mr. Chair, and may I please have 2 questions? And so, Mr. Romans, thank you for the work that you do. My first question is, what is driving the growth in DDA spending? Is it more people are being diagnosed with disabilities because 1 out of every 54 children is now diagnosed with autism, or do the people that we are currently, so are more people qualifying for DDA? Or are the people that we are currently supporting having more significant support needs? And then I have a second question, but I'll let you answer the first question first, please.
Yeah, so I would say that there's a couple of components to what's driving the cost. So, one is I think some poor budgeting on the state's part, but also in the DDA world, we changed our reimbursement system from a prospective system where we provided the providers money up front to a fee-for-service system. The new reimbursement system pays substantially better, like 20% better than the old system. Now, some of that is probably better reflecting the needs of the patients and the clients in the DDA program, and some of it is paying the providers better, as there's long been an assertion that we didn't reimburse our DDA providers adequately. So that the phasing in of that new reimbursement system is a very significant portion of the costs that were unexpected. I think there was some bad estimating of just how expensive that would be to the state. The other component that's going on is there's been a movement towards self-directed care for DDA clients. Now, you can choose self-directed care or going through the regular providers. If you're in the self-directed program, you get much more control of your money and choosing who you hire as your providers. And the health department has found that they found that to be more expensive than they expected. So the self-directed care has grown much quicker than they assumed. So it's kind of a combination of additional client needs, a new payment system to perhaps better reimburse the providers for the services they're delivering, and just greater demand for the self-directed care.
And can I have one more, Mr. Chair? My second question is, I've been getting a lot of agitated emails and phone calls about some extra money that was for DDA providers that was going to Montgomery and Prince George's County, and I believe Charles, and the city perhaps, about some sort of geographic cut for larger jurisdictions. So can you walk me through the governor's proposal with regard to that? Because I think there's a cut in terms of that.
Yeah, so I mentioned earlier there's significant cuts in both the current year and in fiscal 26. One of the larger cuts is that under the current DDA payment system, we pay providers in certain jurisdictions that are seen as high cost more than in the other jurisdictions in the state. And the administration is proposing to stop that differential payment. As you said, Montgomery County, Calvert County, among others, there's eight jurisdictions total who get that sort of enhanced payment under the current system that would not get that going forward.
Thank you, Mr. Romans, for your great work, and thank you, Mr. Chair.
Delegate Williams.
Yes, thank you. Thank you, Mr. Chair, and thank you, Delegate Kaufman, for that question about the regional DDA payments, because it does affect my county. My question that I had, though, two questions. You were mentioning the standard deduction, and that is going to increase for a certain dollar amount. What is the income amount that's going to cap off at, where people would no longer be able to itemize?
So the governor's proposal is nobody can itemize. So for people who are doing the standard deduction now, their standard deduction doubles, so that's good for them. For the people who itemize, they will go from itemizing to getting the standard deduction.
So there's not, so even if I don't make $500,000 a year, I still wouldn't be able to itemize, is what you're saying?
You would not be able to itemize under the governor's proposal.
Interesting. Okay. My other question that I had, I was reading through the briefing about pausing the amount that is being funded for the concentration of poverty program under the blueprint and the growth pause amount. Well, that's my question. What is the growth pause amount that we're pausing at, and what was it supposed to be in the years going out that we're not increasing to?
Yeah, so it's a little complicated, but so just to be clear, the concentration of poverty, no one's going to get less money. No school will get less money as a result of this. They will not grow as they were expecting to grow.
Right, and I'm trying to figure out what that delta is. Right.
Just wanted to make sure everybody was clear. So right now, when a school qualifies for the concentration of poverty program, because say 80% of the students are in poverty, they get a grant per pupil of a certain level, and that phases up over 7 years. So if you got into the concentration of poverty program the first year, I think you're somewhere like year 5 now. So your grant would continue to grow for a couple more years. The governor would stop that growth for that school. And other schools have come in more recently, and they're, at like the second year of the phase-in. So it stops their growth for 2 years. When the pause ends, then you start growing again from where you were. So you go, if you were in year 5, you get to
Right,
year 6.
because the pause is for 2 years, is what I read.
Exactly. So it's less money than they expected. It depends on where each individual school is in getting phased in, how much of a cut it would be.
Okay. That sort of answered my question, but okay. I just was looking for a specific dollar amount. But,
I mean, the total savings in the first year is like $93 million.
okay.
And I have, hold on. Have I got that? Sorry, $70 million in the first year, $193 million in the second year.
Got it.
So across all those schools.
Okay. Okay, thank you.
Thank you, Mr. Romans. As I indicated earlier, excellent briefing, as always. First of all, going back to Delegate Williams' question about itemized deductions, could this impact, if we disallow itemized deductions for high earners, couldn't we greatly impact the amount of money going to nonprofits that are making up for the loss of services from the government? Is that possible?
I mean, the itemized deductions that people take, I mean, charitable giving and, real estate related itemization are the two largest, by far, largest items. I can't say whether they really would change people's charitable giving or not, but I think you could certainly say there's some risk that it might.
Okay. Can I go back to page 6 for a second? The governor's proposing some increases for $187 million. Is that correct?
Yes.
Isn't that about what his budget deficit is for this year?
Ironically,
exactly?
yes. Yes.
Okay, so if he didn't do these budget increases, he would actually literally have a balanced budget.
Well, again, so he's on a cash basis, the governor's budget's balanced. I don't want to mislead anyone. He's $106 million to the good on cash. On structural, he's out of balance by $186 million. So if he didn't do these enhancements, he would largely eliminate the structural budget gap.
Okay. Thank you. Question number 3, income tax. I brought this up with some of my colleagues earlier, but I don't know if you remember back when we had the O'Malley increase in income tax. It was a 0.75% increase on high wage earners for 3 years. You remember that?
Yes.
Was there an analysis done by DLS in terms of the actual, whether in the long run it brought in money or lost money? In other words, did we have more people that left the state that were changed their residency in the state? Or do we have that information, or can we get it?
I don't think we have very conclusive information. I will double check. I was not at DLS at that time, but.
Okay. We, right now, according to all the signs nationally, our economy is doing very well for the most part. Yes, we have inflation, but we have a relatively strong economy, and we have a structural deficit. Usually you have signs of weakness in the economy when we have a structural deficit coming. So if there are weaknesses that come into the economy, could that exacerbate our structural deficit in the future?
Oh, absolutely, yes. If we were to go into a recession for some reason, that would definitely make the structural gap worse. Or if a significant federal agency was moved out of Maryland and that cost a lot of Marylanders jobs, that would reduce our revenues, our income tax revenues for certain. Okay. So there's always a significant risk of any kind of recession making things worse.
So going back to Delegate Moon's question about making sure we're preempting and thinking about these things well in advance so that because the economy it runs in cycles, right? Eventually we're going to go into a recession. Right now we're riding high. Interest rates happen to be high. Everything seems to be going pretty well for us.
Yeah, I would say though, and the national economy, that's true, that the kind of national economy has grown quite well. Maryland's economy has grown, but it's been growing much more modestly. we have very low unemployment, but we don't have much job growth. So most people in Maryland who want to work are working. So we've had, a couple of years of not very impressive revenue growth, and the out-year growth that the VRE is forecasting isn't particularly robust. So part of our problem is that our economy hasn't grown the way we would have liked, or grown at the rate that the national economy has grown.
One last question, thank you, is inheritance tax versus estate tax. The inheritance tax is relatively small compared to the estate tax, isn't that correct?
Yes.
So we eliminate a smaller revenue source and we increase dramatically the larger revenue source. Is that fair?
We're making more households subject to the estate tax than would be now, is what they're doing.
And is there any concern about that changing people's behaviors and moving their estates so that they can't be touched, whether it be in trust? Like we got briefed, or we had information last year about like South Dakota and other states out in the Midwest creating these trust havens that people can move their high estate states that are maybe 4 or 5 million people who have enough money to spend money on a tax lawyer could hide that money for estate purposes. Is that something that could happen?
Well, I think there's always, there's certainly lots of people who spend time helping people plan their estates to avoid taxes. So I would say, it will certainly, I don't think that's going to change. I think people are always looking for ways to avoid the estate tax. I don't know that this proposal changes that behavior, but it will certainly continue.
Thank you so much. Thank you.
Delegate Pasteur.
Okay. No, Mr.
Thank you, and I also want to thank you for this presentation. I've heard it once before, and I still learned a lot hearing it again, so thank you. I have a very specific question and a less specific. One is a constituent who works at a community college pointed out the reduction in the budget in the mandated state share for the retirement costs at community colleges. I don't know enough about their funding sources. What does that mean for the community college in terms of making up that amount?
So local governments need to come up with to make up that difference.
Okay. And if they didn't, would they have to, or is there the possibility that they could not and would not make up the difference?
No, it has to, you have to make the
Has to, okay.
contribution. Yeah, it's a mandated contribution.
The other question is, it's been commented that, our state relies heavily on income tax revenue, and that is why we're very vulnerable to changes in the federal workforce. I wonder, would you describe this budget as diversifying our tax revenue or not really dramatically changing that?
So there's long been a concern in Maryland about volatility of our income tax, in large part because capital gains just naturally swings year to year depending on a variety of factors, including how the stock market and other things do. And Maryland actually has some provision in statute that sets aside some revenue when our budget seems overly reliant on capital gains. We set aside a small amount of the revenue estimate not to be spent as sort of a hedge against being too reliant. The governor is proposing to not set aside money for volatility. And I think his proposal, again, I'm not judging the proposal as good or bad, but from a volatility standpoint, it makes us more, we're adding an additional tax on capital gains, so the volatile revenue source, and we're raising the brackets on high income earners who tend to have most of our capital gains. So it definitely increases the volatility that we are going to experience in the future. So that when we hit the recession that was asked about before, there's more chance that it'll be a bigger dip in our revenues than we've otherwise been. So I think there is some downsides to the governor's plan in terms of the volatility.
Thank you.
Now, Delegate Pasteur.
Okay, thank you, Mr. Chair, and thank you for this. Every time I read this or hear it, I have even more questions. But mine are around education. So I want to go back to Delegate Williams' question about the concentration of poverty. So now we will be looking at a phase-in of, correct? All right. So with the concentration of poverty, we were considering by student, not just holistically, not just looking at a system, not just looking at a whole school, so that we were making sure we were looking at the needs of the students. What is the determinant? What is it that is going to determine which schools and how much is going to be reduced? Or is that not going to be a factor? It's just going to be a plain cut regardless of what the needs of the schools are, the
Right,
specific
so,
schools.
so right now in fiscal '26, where schools with, that have 60% or more of their students in poverty qualify for the concentration of poverty grants. And so for a school that is at 80% of poverty, which is the high-end figure in statute, they get a per pupil grant that's 66, is being phased in over time. So in fiscal '26, their per pupil grant is 66% of the maximum amount. In fiscal '27, they're supposed to get 75% of the maximum amount. In fiscal '28, 100%. The governor's plan pauses them at the 66%, so they wouldn't grow to getting 75% of that per pupil amount in '27 and 100% in '28. So that's kind of, so the school wouldn't lose dollars, they just wouldn't get the growth in dollars that they were expecting.
And it depends on where that school is in the first place.
Yes.
Okay, thank you. All right, and about the consortium, each county had its own set of programs under the consortium umbrella to support whatever their needs are for the students. So in delaying the services, and I'm thinking just the equity for the counties and for the schools that are in need of them, again, how is it determined? How is that reduction determined, or which services are going to be plucked out? Because as it is anyway, not every county has the same number of services. So how is that going to be determined?
So I don't think all the details are clear right now, but in the current fiscal year, 40 million was the amount allocated to the program. It was supposed to grow to 130 million and permanently stay at that level. So the governor's just keeping it at the 40 million. So it sort of will prevent expansion of services going forward.
So the counties, since they all have different services, different programs, different needs, those LEAs are going to have to be responsible, I guess, maybe, for which programs they are now going to cut.
Or at least they're not going to be able to expand beyond what they're already doing. If they either may have to make some cuts or they may have to limit to what they're doing already with the 40 million.
But they are going to have to make that decision.
Yeah.
Because in some cases, they are going to have to cut programs. In others, they could keep them right where they are.
I think that's true. Yeah.
Okay. And collaboration. Collaboration. Explain to me, please, how collaboration fits in with this. What is that's the driving force for being able to make a significant fiscal change? I'm old school, so collaboration and what folks do, mentoring and whatever, supporting teachers, that was an administrative decision. So explain, please, how that figures into the savings that we're going to get.
Right, so part of, I think, the Kirwan Commission's proposals, one of them was that they wanted to essentially reduce the amount of time teachers spent in the classroom to have more collaborative time. And right now, it was estimated, at least when they acted, the teachers spent about 80% of their work time in the classroom. The goal was to reduce that to 60%. And that was going to start being, funding to do that was going to start in fiscal '26 and be phased in over 4 years. The governor is saying, we don't have enough teachers to backfill, for this collaborative time, so let's pause that. Let's not do that for 4 years. Let's start it in fiscal 2030 rather than fiscal '26.
Okay, and again, I was on the funding committee for Blueprint, and so the collaborative time had to do with mainly teachers who got national certification, et cetera, and they were told, you can come out of the classroom for a percentage of time And that way you'd be able to mentor teachers. Administrators were also supposed to have some classroom time. So this is why I'm struggling with the amount, because that was a promise, an unintended consequence, in other words. So you just tell them you don't get this amount of time out of the classroom, because once you go back into the classroom, that sort of eliminates a little bit some of the shortage. So can you just tell me where I can find information that further explains that? Because I clearly remember explaining it when we were having the funding committee. And so I'm not real clear on how to make this transition in my brain about how that's going to impact, because I know before we had a blueprint and said any of that, we worked in the schools to make sure they had that collaboration. And with that piece that principal or administrators are supposed to also offer support, I just need some backup, because I have to tell you that superintendents, teachers, administrators are asking me that question, and we all are saying the same thing. We can't figure it. So if I could just get something.
We will provide you some more information.
I appreciate that. Thank you.
Delegate Phillips?
Thank you, and thank you for going through the governor's budget. It's helpful, because I would tell you, going through all the reading materials has got my head spinning, and I was an accounting major. So a couple of questions. One, if we go to the investments, the $187 million, anywhere do we talk about what the potential impact that will have on our economy in a positive way in out years? I know these are investments, but usually with an investment, you're expecting some return. And do we talk about that anywhere?
The budget doesn't make any explicit assumptions about the return, so there's no like add to the revenues in the out years from the return. But clearly the governor's hope is that these programs will have a return and help grow our economy.
And so in the past, is that ever a policy that we say, yes, we're going to make investments in certain things with an expectation of a return, so that we understand what that is as legislators?
Well, I mean, certainly the state makes many investments in the economic development area with the hope that it's going to help our economy. We don't normally, as a state, assume a big return on investment in the out years in our revenue estimates. We tend to wait and see it actually happen, if you will.
All right. We might need to think about that. Do we know what the numbers are in terms of people that are itemizing today versus, just to give us a sense?
About 23% of filers itemize right now.
And so that 23%, and I know we're raising the standard deduction, but presumably some portion of those, they will see an increase in their taxes if they're not able to itemize.
Yeah, I mean, I think the average the average itemization is in the high 20,000 range. So if you're itemizing in the high 20,000 and now you just get, as a joint filer, 11,200, you suddenly have a lot more income that's taxable. So.
Okay. Can you explain the trade-in allowance piece again? I heard you. I wanted to make sure I understood it.
Sure. So current law, if you buy a car for $50,000 and you're trading in a car that's valued at $20,000, you only pay the excise tax on your vehicle purchase for the $30,000, the difference between the car you're buying and the value of the car you're trading in. So it's a tax reduction for the buyer. The governor's plan says you can only get the trade-in allowance if you buy a vehicle worth $15,000 or less. So someone buying a new car is not going to get any trade-in allowance in terms of their taxes.
Do we know how much of an impact that's going to be, like the number of individuals that are buying new cars?
So the Department of Transportation has been using a figure that 40% of vehicle transactions in their system are for vehicles 15,000 or less. But I understand that includes like private transactions, like you sell the car to your kid for a few $100s or something. So it may distort what's really going on at a dealership level, and we don't yet have data that removes the private transactions.
And I think I had one more question. I'll leave it at that. I do have a question about the settlement, but I'll leave it at that. Thank you. Sure.
Thank you, Mr. Chair, and thank you, Mr. Romans, for a very thorough overview of the budget. I guess my first question is, well, it looks like the budget is mostly reliant on cuts in revenues to balance out. Has there been any performance audits of different departments to determine the effectiveness of, where we've invested money? And in addition to performance audits, have we identified any fraud, waste, and abuse across departments?
Well, I'd say the Office of Legislative audits every state agency, and I believe like roughly a 3-year cycle. So they are always going in and looking at, making sure they're spending the money appropriately and that there's not fraud and so forth. So they issue published reports with their findings. So there is a regular audit cycle that attempts to capture problems in agencies or just bad, like they're not keeping the right records that they should, so you can't tell if they're doing a good job. In terms of performance audits, there's not a robust level of performance auditing in the state. Legislative Services has periodically looked particularly at some of our tax credit programs and made recommendations about whether they are particularly vibrant or not. I think the governor actually is trying to eliminate one of those programs based on a years ago study that we did, but I would not say we do as a state a robust amount of performance on it.
Yeah, and I think it's helpful. I mean, I managed grants for many, many years, and one thing we would do annually is go in and we would do performance audits to determine, is this program effective? Is it efficient? Should we continue funding this program? So, going back to Delegate Phillips' question about our return on investments. The other question I have too is that you mentioned the increase in child care subsidies. So you said currently there are about 42,000 families that are benefiting from this subsidy. And you said, I guess you said that the governor is going to cap that at about 42,000. But I believe the previous year was about 23,000. Is that correct?
Back in fiscal 23, so a couple of years back, there were about 23,000. We've seen tremendous growth to this roughly 42,000 level, and we were expecting it to continue to grow in fiscal 26. And the 42,000 is a children served,
Children, not families,
smaller
but
number
children.
of families,
Okay. So what contributed to that increase from 23 to where we are currently at 40,000 or so?
The state has made some efforts to make the child care program more accessible. We raised the maximum income level that you could qualify for the program. We also, over the last 4 years or so, have improved the reimbursement rates for the child care providers, and to better align with their actual, the actual experience. Previously, we were paying at a very low rate, so that most child care providers, they would accept the subsidy, but it didn't cover your full cost. So the family still had to put a lot of money out of pocket, and a lot of families couldn't afford to do that. So by improving our reimbursement levels, the subsidy covers many more providers' costs, so that many more are accepting the subsidy without charging the family more. So it makes it easier for families to find child care that they can pay for.
Okay, and then my last question, just very straightforward. How much would we save if we were to freeze the blueprint funding?
Oh, goodness. So there's a chart on page, I want to say 14 maybe, that shows how the blueprint fund, 12, thank you, page 12, it's on the screen. It shows how the blueprint fund's being funded. So you can the combined bars show the growth year to year. So the program is growing, it depends on the year, about 600 to 800 million a year. And you can see from that chart that in fiscal 26, we're spending about $2.5 billion on the blueprint. By fiscal 30, we're getting close to $4.5 billion. So if you froze it for the next 4 years, you'd save, a couple of $1 billion.
Okay, great, thank you.
Thank you, Mr. Chair, and thank you for this. And I especially like the color coding. There are a lot of folks in my district that are interested in have cannabis businesses. So I kind of want to understand fully under the tax and fee proposals list, the increased cannabis tax rate from 9 to 15%. Is that a consumption tax or a corporate tax? So is it a cannabis business tax rate increase, or is it me consuming cannabis, I'm now paying 9 to 15%?
I want to check. I don't want to give you the wrong answer, so I will get back to you.
Okay, thank you. And then there's another cannabis category under other revenue proposals, the social equity partnership grants fund swap. It's the only negative in that category. I don't understand what the partnership grant fund is. Maybe can you explain that and explain why it's a negative there?
So there's like a $5 million grant program that was being funded with general funds that is now going to be funded with the cannabis revenues. So we get revenue from cannabis, it goes into a pot, there's a bunch of things that we're supposed to spend the money on, and we're adding to that list this social equity amount, so they'll spend some of the special fund revenues from the cannabis tax on that program. At the end of the day, any money that doesn't go to a cannabis-related program goes to the general fund. Because we're saying we're pushing this $5 million costs onto the cannabis fund, there'll be less money left over when they spend on all the things they're supposed to go to the general fund. That makes sense?
Yeah, sort of. Okay, I can take that, and I can do more research on just, exactly what is the equity partnership fund. I guess that's part of the question.
I think it's trying to diversify the business, get more different, more minority business and
Yeah,
so forth
sure.
into the program.
Okay, all right, thank you.
Delegate Sample Hughes.
Thank you, Mr. Chair, and thank you, Mr. Romans. I always enjoy your presentations. I could talk to you all day long. I just had 3 categories of questions for you. First, I'll start with the blueprint, and thank you for the blue ink that you used to outline a couple of the categories for revenue. I know first and foremost, you had indicated the sports wagering as being one of them and table games, but can you answer for me, do we also receive funding from the digital downloads that we passed a few years ago for education? Do we also receive funds from the cannabis tax for education as well?
I don't believe any of the cannabis tax goes. The Blueprint Fund gets money from a lot of different sources. Most of it is gambling and a portion of the sales tax. We ended up, I think we may have started with some of the digital going, but we ended up just sending a percentage of our sales tax revenue goes to the Blueprint Fund. Most of the rest goes to the general fund. So that's a significant source of revenue for the Blueprint Fund.
So we may still get a little bit of the digital download.
Only within the sales tax. It's not explicitly the digital downloads. It just gets a share of the sales tax revenue.
Okay.
So it's getting too complicated for the comptroller's office to splice all these separate pieces of, revenues. So we
Right.
just gave a percentage of the sales tax.
And that's where my constituents kind of get confused. They're like, you asked us to come to the polls to support, cannabis, support the sports wagering, et cetera. They just, wanting to know where this revenue comes from. And then especially when we find some of these are a little controversial, but the cannabis, you said that's nothing
not go to the
towards
Blueprint.
education? Okay, all right. Along the same lines of the education conversation, I saw that you noted that $130 million will be cut from the behavioral health services for education. Is that correct?
We're going from the mandate would be 130 million. The governor's saying, let's not have the mandate be 130, let's make it 40. So he's making a cut of 90 million, reducing that mandate. And that is a permanent change to statute in his proposal.
Okay, and that's concerning, given the fact we have a lot of behavioral health needs in our education system. And then in a budgetary question for you, as one of the discretionary enhancements, it shows that behavioral health for Medicaid enrollees, that's an increase. So are we taking the behavioral health funds out of the school system side, but yet adding more for Medicaid enrollees?
So There's growth in Medicaid spending on behavioral health. So for those children, there's definitely more money potentially there. The behavioral health part of the blueprint was sort of an add-on of additional, making sure there's even more resources available for behavioral health services for children, if you will. And so the governor is basically really limiting that to the 40 million, but there would still be Medicaid coverage for Medicaid eligible children to get behavioral health services.
But those who are not eligible for Medicaid, they're going to incur the cost even more so.
There's certainly less money for those who are
Yes,
not
indeed.
Medicaid eligible to help provide their behavioral health services.
Okay, all right, thank you. Second part question, not education, but I wanted to go back to the inheritance tax. So Maryland, from what I can tell, is the only state that does the estate and the inheritance tax. Is that correct?
I believe that's true. Yeah.
And this is the part where I kind of get hung up. So while that person is alive, they're paying their taxes. When they become deceased, there is the estate tax that's on, as well as the inheritance tax that someone obviously has to pay. And then they continue, whoever inherits the property has to continue to pay traditional taxes, right? The part that I guess was concerning for me is that part of those funds pay for the Register of Wills office. And I know that you noted that it's going to be like a net balance. Will that still be able to fund the Register of Wills when we look at taking the inheritance tax? And I'm not fond of the inheritance tax. We've been paid a lot of taxes. And I know that what's often said, well, oh, if you're related to the decedent, then, it's great. But it's not great when you're not. And you're kind of like figuring out, well, how the hell do I pay for this money? Let me get this to get the inheritance. Not your problem, but I'm gonna come down. Okay, so I'm just trying to understand how this becomes net neutral and to address the Register of Wills office still being funded because they do good work, but how does this come to pass?
Right, so the inheritance tax generates about 100 million, roughly 100 million a year for the state. The registers of wills are funded out of that amount.
Right.
They get roughly $30 million a year from the inheritance tax to cover their operating costs. The administration, in an oversight, I think didn't contemplate that there was no other way to fund the registers of wills. So I know the administration is aware that they have not provided any funding under this plan for the registers of wills, and I think they are working on some sort of solution to that.
Okay, to find the 35 million.
Yes. So it was an oversight on the administration's part.
Okay, got it. One last one, this is actually judiciary related. So the Child Victims Act, is that only for persons who've been affected by state-run facilities? I know you mentioned about the juveniles that were in state facilities. Or is that applicable to someone who was not in that facility?
I believe that there are other people who are in state custody, whether in foster care or otherwise, could sue us. As I understand it, only like one of the 3,500 comes from the foster care system so far, which doesn't mean there aren't more people out there who could come forward. But it seems like the focus, if you hear the radio ads, the focus of the councils are looking for people from the juvenile services facilities.
Okay, all right. Thank you so much. Thank you, Mr. Chair.
Thank you, Mr. Chairman. Thank you for coming in for the briefing. In reference to the cut in behavioral health for the school children, is the current amount that we're spending, is that 40 million?
Correct.
That's the current amount. And the proposed amount was to move to 130 million.
Well, the statute was proposed at being 130 million. The governor is proposing keeping it at 40.
Right. So everyone will get the same current funding, pretty much?
Essentially, that's what the proposal is.
Okay. Thank you very much.
Last question, Delegate Thomas.
Thank you. No pressure. Thank you, Mr. Chair. So obviously we've talked about how there's going to be an increase in for Maryland's highest earners with capital gains and income tax. And there's been, from one side of the aisle talk about, that when we raise taxes on the highest earners, that this chases, pushes those folks out of the state. Do you guys have any, within your office, any data that shows that that's true or not true, or what's happened in the past?
Well, there was a question earlier about the millionaires or the high earners tax that was in place for a few years. I will go back and see. I'm not sure that there was anything published. I am told anecdotally that there was some evidence that maybe like 1% of high earners moved out of state, but I'm not sure that anything was actually, like an actual report was done showing that data.
Gotcha. And then my other question was about under the discretionary enhancements, and I asked this question, I hope Delegate Simpson, don't run across here and strangle me. I'm not messing with downtown Frederick. No, it was, no, I'm in the Frederick delegation, and this got brought up, I think 2 years ago, and I asked about it, and I don't think I ever got a straight answer. With the hotel project, is that just standard protocol that state dollar? I just don't understand how that works. Is that a standard protocol where the state kicks in money for hotel projects?
The state will at times. You see it more often with the capital budget bill and bonds and so forth. But we do support local projects and economic development type activities.
Yeah, I guess, yeah, okay, gotcha.
Delegate Simpson with a question for Mr. Romans.
Absolutely.
Okay.
Isn't it so that sometimes it is sometimes very important for the state to invest in certain projects to make sure that they remain in the city, the county, or the state control so that it doesn't become a Costco in the middle of the city of Frederick?
There's certainly a long history of the state funding projects of this type.
And a fraction of what the whole cost. But thank you.
Very diplomatic answer. Well done. Thank you for not doing whatever was going to happen. All right. That's all the questions then. Thank you very much. I think that really was all the questions. Thank you for the fiscal briefing. It is 12:15. We have bill hearings scheduled at 1 o'clock, and if it doesn't bother anybody, I think we'll start them at 1:15 to give people an hour, and then let you take a break from this and come back. So we will be back at 1:15 this afternoon to do bill hearings. Thank you.